Hi, this is Dr. Rishi Gupta. I'm an Associate Professor of Ophthalmology at Dalhousie University in Halifax, Nova Scotia. Eye basics. The eye is like a camera. There's a lens in the front of the eye, and we call that a cataract if it has clouded over from aging changes. Light gets focused on the back of the eye, and the tissue that lines the back of the eye is called the retina. The center of everyone's eye is filled with a jelly fluid called vitreous. What is an epiretinal membrane? The most important part of the retina is a tiny divot right here. Although it only measures a few millimeters, this area, called the macula, is what we use to read and see people's faces. The rest of the retina we use for our side vision or our peripheral vision, but the center is what allows us to see details. Some people, unfortunately, can get some scar tissue that grows over the very center of the vision, over the macula, and we call that an epiretinal membrane. This is a high magnification picture, or OCT, of a normal macula. The bottom picture is of a patient with an epiretinal membrane. You can imagine that because of this change, a person's vision might be blurry or crooked or distorted. What causes an epiretinal membrane? The center of everyone's eye is filled with a jelly fluid called vitreous. With aging changes, in almost everybody, that vitreous gel will peel away from the retina. Unfortunately, in a minority of people, some scar tissue may grow in over the center of the vision, or the macula, when that process happens. Can surgery remove the epiretinal membrane? Surgery is the only option to remove an epiretinal membrane. What happens if I just leave it? If you do nothing about the epiretinal membrane, it may get worse with time. Typically, this is slow, over months to years. Some people's epiretinal membrane may never progress, and it's for this reason that we only recommend surgery if you are having significant blurring or distortion of your vision. Because it is only affecting the very center of your vision, even if it were to get worse, you would never go blackout blind because of an epiretinal membrane. If the epiretinal membrane is removed, will my vision be normal again? The first goal of surgery is to remove the epiretinal membrane. This should stop your vision from getting worse over time because of that scar tissue. However, even with successful surgery, your vision will never be perfectly normal again. There is damage done from the epiretinal membrane that likely will stay. However, most people will get an improvement of about 1 or 2 lines of vision on the vision chart. This is a slow improvement over about 6 to 12 months following surgery. Any distortion or waviness that you see may likely improve, however, may not completely go away. If the epiretinal membrane is removed and my vision is still blurry, would glasses help? Glasses may be able to help to a certain degree. However, there's a part of the vision that glasses cannot help. Again, there is damage done from the epiretinal membrane that we cannot necessarily get back. You should wait about 6 weeks after surgery before meeting with your glasses doctor to see if the vision may be sharpened up a little bit with glasses. Tell me about the surgery. The surgery to fix an epiretinal membrane is called a vitrectomy surgery. We remove the jelly fluid vitreous that fills the eye and peel away the scar tissue with micro instruments. It is a day surgery, meaning you will not have to stay in hospital overnight. If you have not had a cataract surgery previously on that eye, typically this is done at the same time. I've heard of people getting a gas bubble in their eye after retina surgery. Do I need that? When surgery is done for other conditions, such as a macular hole or retinal detachment, it is very common for gas to be left in the eye at the end of surgery. It is much less common in the case of an epiretinal membrane for gas to be needed. We would only know this at the time of surgery, and will tell you after the surgery if gas has been placed and what special instructions you would therefore need. Do I get a general anesthesia? We know that the thought of having eye surgery makes most people anxious. So we have another doctor in the room, an anesthesiologist, who is there to give you medications to keep you calm and comfortable through an IV. So while you will not have a general anesthesia, it's not uncommon for patients to fall asleep during surgery because of the medications that you are given. And of course your eye will be frozen, so you should not feel any pain. What do I need to do after the surgery? After the surgery, it is important to keep the eye clean. Do not rub the eye or bump it. Make sure that you take your drops. You can use Advil or Tylenol for pain. After the surgery is done, our nurses will go over all your instructions with you. What is the recovery after surgery? Usually there is not too much in the way of pain. It is normal for the eye to feel scratchy or like there is a grain of sand in the eye. Day by day gets better, and Advil or Tylenol should do the trick if needed. You will have drops to take, and we ask that you take it easy from activities for a few weeks. What are the chances surgery makes me worse than if I just left the epiretinal membrane? The chance that surgery might make you worse is about 1 to 5%. This includes uncommon complications such as an infection, a retinal detachment, or a bleed in the wall of the eye. What are the chances surgery makes my vision better? About 80 to 85% of patients will notice improvements after surgery. What are the chances surgery doesn't improve my vision, but at least keeps it from getting worse with time? In about 10 to 15% of cases, after surgery, the vision is about the same as before surgery. However, we look at this as a win if we have removed the scar tissue and prevented you from getting worse over time. Is an epiretinal membrane the same thing as macular degeneration? Macular degeneration and epiretinal membrane are two separate things, but that both happen in the same place, in the macula, the very center of the retina. What are the chances it happens in the other eye? There is about a 20 to 30% chance that somebody would have epiretinal membrane in one eye and then develop it in the other eye. Unfortunately, there is nothing we know to prevent this. So I hope you found this video helpful, and thank you very much for your time.